My name is Ethan Veneklassen, and I'm the Head of Advocacy and Communications here at ID 2020. Because our panel, not to mention our audience, is global, let me begin by saying, as I do each session, good morning, good afternoon, or good evening, wherever you are, and welcome to this fourth and penultimate installment of the ID 2020 Summit Sessions webinar series. For those frequent flyers who've been participating in all of our sessions, thank you. We really do appreciate it, and congratulations for your endurance and commitment. To those of you who are joining us for the first time, welcome. This is also a fantastic opportunity to remind everyone that these sessions are recorded and they're available in the media section of the ID 2020 website at id2020.org. So if you missed one of our previous sessions, you can go back and listen at your convenience. Before I turn things over to Rebecca, I'd like to remind you that our closing session of the series is 1 week from today rather than 2, which has been our normal cadence. Our closing keynote speaker is Congressman Bill Foster of Illinois. Congressman Foster is a member of the House Select Committee on Science and Technology and the House Committee on Science and Technology and the House Select Committee on the Coronavirus. He's also the author of the Improving Digital Identity Act of 2020, and for the life of me, I don't know why I find this so fascinating, the only PhD physicist in Congress. So it should be a fantastic session. As always, I'd like to thank our partners at Biometric Update for their support. So here's how the session's going to go today. Each of our panelists will speak for about 5 minutes of opening remarks. Then we'll have moderated discussion and follow that up with audience questions. We'd like to remind folks to please post their questions in the Q&A box, and we'll get to as many of those as time permits. With that, it's my privilege to introduce my colleague and your moderator for today's session, ID 2020 Senior Advisor for Global Health Programs, Rebecca Dissler.
Thank you, Ethan, and thank you all again for joining us today. As we all know, more than 1 billion people globally lack any form of officially recognized ID. But what we sometimes brush over is that the majority of those people are under the age of 15. In fact, 1 in 4 children worldwide are never registered at birth. When children don't have a form of ID, it can be difficult to ensure they receive early vaccinations and essential health interventions. If they, as many do, reach school age without a birth certificate, they are often unable to enroll in school and receive an education. And if they grow up, it becomes more difficult for them to participate in the formal economy, whether that means opening a bank account or applying for a job or getting a driver's license. So when we talk about the promise of digital ID to improve service delivery and build more inclusive societies, we have to talk about how it's going to impact the next generation. When done right, digital ID from birth could set the foundation for young people to grow and prosper. But questions of how to provide functional digital ID for children from a technical, ethical, and operational perspective remain unanswered. This includes questions on the role of technology, from digital civic registration platforms to advances in reliable biometric authentication for children. It's essential considerations on privacy and consent, as well as data sovereignty and guardianship. And it's questions on how to design and operationalize these programs, how to mobilize governments, civil society, funders, regulators, private sector technologists to ensure that proposed solutions are privacy protecting, portable, and persistent across the lifespan. This is a particularly complex topic, and these are tough questions. But I have to say, I couldn't dream of a better group of experts to help us navigate them today. So with that, I'm delighted to introduce you to our panelists. Anir Chowdhury is a policy advisor for UNDP and the government of Bangladesh. He is leading the formation of an innovation ecosystem in Bangladesh that includes capacity development, policy formulation, institutional reform to transform the bureaucracy into a forward-looking, citizen-centric service provider. Anir is a member of the Prime Minister's National Digital Task Force, Education Minister's National ICT and Education Task Force, Planning Minister's National Information Management Committee, and Cabinet Secretary's National Steering Committee on Civil Registry and Vital Statistics. Sam Mueller is a Senior Country Manager, Asia Pacific at Gavi, the Vaccine Alliance. Sam is responsible for managing Gavi's support to Indonesia, Timor-Leste, and Bangladesh. Prior to joining Gavi, he spent over 20 years working on the Australian aid program in Vietnam, the Philippines, Indonesia, Papua New Guinea, and the Solomon Islands, supporting government programs on HIV and injection drug use, governance and election reform, public sector strengthening, and education. Edward Duffus is the head of digital and innovation at Plan International, where he's working to enable girls' rights and gender equality through the appropriate use of digital technologies and innovation. Prior to joining Plan in 2013, Ed worked with Accenture Development Partnerships, leading a team to develop a strategy for ICT for D capacity building in Africa and Asia, and served as an officer in Her Majesty's Armed Forces. And finally, last but certainly not least, Villa Starr is the president of the Patrick J. McGovern Foundation, a 21st century philanthropy advancing artificial intelligence and data solutions to create a thriving, equitable, and sustainable future for all. Vilas is an entrepreneur, technologist, and human rights advocate with a lifelong commitment to creating more robust social institutions that foster shared opportunity. He also serves as a trustee of the Christensen Fund and as a member of the Global AI Council of the World Economic Forum. As I said, we could not have dreamed of a better group of experts. Thank you all again for your time. And with that, I turn it over to Anir for his opening remarks and reflections.
Thank you, Rebecca. Good morning, good afternoon, good evening. I'm, I guess, at the border of evening and morning, I guess 1 a.m. here. So I guess both apply. So it's good to see all of you. Interestingly, so Rebecca, Ed and Sam are both all three are involved in work in Bangladesh. And I guess Vilas is going to be involved fairly soon. So all roads lead to Bangladesh in the case of digital ID, it seems. So let me share a couple of reflections. One is how our birth registration came about. So it started in 1873, not 1973, but 1873. And we introduced electronic birth registration in 2004. So we saw between 1873 and 2004, in 131 years, we were able to register about 8 to 10% of our population. And ever since introducing digital birth registration, which is registering birth digitally using this software that was built by UNICEF originally, between 2004 and now, we've been able to register all of our populations. It's maybe there are some pockets that are still left out, but it's close to over 160 million people that are registered. So the birth registration concept came from a sort of human rights perspective. Everybody needs to have birth registration. Everybody has that fundamental right. The digital ID concept came later. So it was a digital birth registration, but the digital ID, which is biometrically verified, came in 2007-8 timeframe to hold a free and fair election at the end of 2008. So we needed to actually develop a voter registration system during that time because we had a political difficulty and a lot of shadow voters or ghost voters. So that was the reason that this was created, and it was subsequently, I guess, upgraded to a national ID. It started as a voter ID, national ID now. So that came from a digital service delivery perspective, starting with voting. So you're voting, fundamental right, you're casting a vote. It's actually verified against biometric registration, and that's how it came. And that became the foundation for a lot of digital services today. So Bangladesh started the very serious effort of building a digital nation in 2008, at the end of 2008, with the announcement of the then Prime Minister, well, the same Prime Minister now still. So it got her a lot of first-time voters to vote in droves, and there was a landslide victory at that time, end of 2008. And that was the promise of building a digital Bangladesh, which is next year. The target is 2021, the 50th anniversary of the country's birth. And digital ID became the foundation of a lot of the digital services. We have about now 700 or so digital services, and a lot of them are pegged to the digital ID. So the birth registration came from that human rights angle, and the digital ID came from the digital service provision angle. And now we are merging the two. So birth registration, which is not biometrically verified, and you can actually potentially do multiple birth registration, which is often done. And national ID, which is biometrically verified, you cannot potentially do it multiple times because it's actually verified against your 10 fingerprints and iris right now. And we are looking at other forms of biometric as well. So they're merging right now in the way that we provide the new civil registration and vital statistics work that we're doing now, which is a secretariat that we have established at the Cabinet Office so that it's a whole of government execution, because we saw with digital ID creation in the government, we actually have created multiple digital IDs. Only one verified biometrically, but there are multiple digital numbers. So in education, in primary education, we have one number. In secondary education, we have another number. In health, we have one. In labor division, we have another one. Obviously, birth registration is one, national ID is another one. So we saw half a dozen digital IDs, not interoperable, in silos, and you're not able to share data, and you're not able to tell who's receiving what services. And the whole concept of digital ID is that we want to make sure that it is the foundation for inclusive service delivery as well. So we're not able to figure out with all these digital IDs which are not connected, whether we are being inclusive, we're leaving out somebody, or some different people are getting the same service, or same people are getting different services that they should not be. They're registered in multiple social safety net databases they should not be registered in. So that's why we're now merging all these efforts. And I'll talk more about some of those, how they're being merged. But I'll just end with just one last minute, Rebecca, and that is how an effort to merge our health department, which does immunization in a very effective way. 98% plus of our children are immunized with support from Gavi. So we use that process to introduce birth registration by getting information collected by health workers who go door to door and sending that information over to our birth registrars, so that birth registrars don't have to wait for parents to come to them with the right information. And we tested this about 4 years ago now, in 2016 to 2018. We did this experiment in one location of the country where the birth registration within 45 days, which is the legal mandate, went from 1.4% to about over 90%. So that was the jump, because we had two departments working together with facilitation by the Cabinet Office with our CRVS Secretariat, and we were able to jump the number of birth registration within 45 days from 1.4 to over 90%. So this is the power of whole of government approach of different departments coming together and sharing information. More later. Thank you, Rebecca.
Thank you, Anir. And with those remarks, I will turn it over to Sam.
Great. Thank you very much, Rebecca. And thanks, Anir. Good evening from Geneva to everyone, and good afternoon, good morning, and the rest, depending on where you are around the world. Look, Anir's already touched on the partnership that we at Gavi now have emerging with the government of Bangladesh and also with ID 2020. And I might come to some elements of that later on in my opening sort of remarks. But I suppose the question many people might have is, why is Gavi an alliance that is looking at improving immunization coverage, that wants to continue its mission to reach under-immunized children around the world and zero-dose children? Why are we interested in digital identity? Why do we believe it contributes to our mission? And I think there's a few important considerations here. Rebecca mentioned in her opening remarks just the number of children globally who have no form of identity, no form of legal identity, 1 in 4 children. At the same time, around the world, there are millions of children who are under-immunized or who never received a single vaccine, zero-dose children, as we call them. And I'll give you an example, a country like Indonesia, where 20 million children, at least, if not more, but the government recognizes 20 million children lack any form of legal identity. They're not only not registered, they have no birth certificate and no identity. Likewise, every year in Indonesia, 700,000 children are under-immunized or do not receive a single vaccine. And there's got to be some connection here between those children who cannot access any government service, social protection, education, healthcare, or immunization, between that lack of legal identity and access to immunization services. So for us, there's a clear opportunity here to look at how we can work with partners around the world to improve access to digital identification systems, to develop those systems, to roll those systems out with the goal, as Anir put it, of inclusive service delivery, ensuring everyone can use that legal identity, that digital identity, to express their right to government services such as immunisation. What are the benefits for immunisation of a digital identity? I can sum them up very, very briefly. Data is a big one. Immunisation records sit across multiple paper-based systems, often siloed in different parts of the Ministry of Health, often in home-based records, in health facilities, and at the ministry. If you can bring those siloed paper-based systems into a digital system, you can triangulate across that data. You can identify the child who has never been vaccinated or who's under-immunised, and you can follow up with that child. Data also leads to better estimations of population. Many countries around the world struggle with civil registration and struggle through census and whatever to identify their actual population. And that's important in immunisation because you've got to order vaccines, you've got to quantify your requirements. So a digital system and better data helps us improve government planning, budgeting and resource allocation around immunisation. It also improves the whole delivery experience, service delivery experience of immunisation for a caregiver and for the vaccinator. If someone can bring their child in, their child is easily identified, the vaccinator knows what antigen that child needs, all based on a unique digital identity that can be taken from health centre to health centre across the country and still achieve the same service. That whole delivery experience is better and is likely to lead to more continuous demand. So really, for us, I think as our partnership with the government of Bangladesh is demonstrating already, there is a tremendous opportunity for Gavi to engage in this space in Bangladesh, to learn from the experience of Bangladesh, to capture some lessons with our ultimate objective of being able to roll that experience out to all Gavi eligible countries. So thank you.
Thank you very much, Sam. Ed, I turn it over to you.
Thanks very much, Rebecca. You know, in your introduction, Rebecca, you mentioned, many children getting to school age without a birth certificate, and that riles me now as it did sort of 8 years ago when I started working in this area of birth registration and civil registration in general. And we know that some of the numbers have already been mentioned, the number of children around the world without a legal identity. 1 in 4 around the world. In Africa, sub-Saharan Africa, it's way worse. 1 in 2 children don't have such a legal identity, and that's really what's in many cases holding them back, not allowing them to be protected and being provided with services such as health and education has already been mentioned. So for the last few years we've been working hard in this area to really tackle sort of the formal civil registration systems which exist around the world and trying to improve upon them where we can. So why is it that these birth registration systems as part of CRVS systems are failing? Well, many of them, really quite antiquated, outdated, inefficient, centralized processes, which favor more the administration of those services rather than the people they're designed to, or maybe not designed to serve, I might say. Often the legal frameworks and regulations are not facilitating registration of individuals, particularly the poorest and those in hard to reach areas. They're just not serving them. As working with Anir in Bangladesh, there's a mantra around the time, cost, and number of visits it takes someone to get registered, and those numbers have been in the past, way too high. And the systems, so the digital systems to support civil registration and vital statistics are also poor around the world in many low-resource settings. Either they're paper-based systems, or even when they're digitized, often they're homegrown systems which are not sufficiently developed to really include the necessary security, safeguards, etc., and the quality of system to make it available, in particular in rural locations. And where governments have then procured systems from proprietary vendors, they often get locked into really disadvantageous long-term contracts. So a few years ago, we thought, well, here's a case where an open source solution, a digital public good for civil registration was really required. So we created Open CRVS. You can check it out at opencrvs.org. I won't be able to cover too much of it here, but just in a nutshell, what we try to do is really set out from the beginning to design Open CRVS for low resource settings. We took a very sort of human-centered design approach. We worked in a number of countries, a lot of time spent in Bangladesh, understanding really at the community level, who are the community actors, what is the situation in rural areas, to be able to better provide services via digital means, often using local agents like health workers, for example, to actually provide these civil registration services at a local level. We've created it as a digital public good. It's now publicly available. You can download it at GitHub and explore using it, configuring it, and customizing it for your own purposes. And in it, I guess, without going into all the functionality, we've tried to enable new models of civil registration. We found that the old models were just not fit for purpose. So in the past, the models used to be about passive registration. So registration would take place in a civil registration office, often at sort of a district level. And we've been trying to promote active registration models, as Anir mentioned, using health assistants at a local level, other community leaders, for example, to capture information as soon after birth as possible. Also, new models of efficient automated processes to reduce the burden on civil registration staff, such that they can spend their time on value-add services, and then multiplying the number of sources of civil registration data, getting notifications from health systems, local health facilities and hospitals, as well as from the community areas. So making sure that OpenCRVS is interoperable with other systems was really important. And at the same time, by making a firm investment in high quality technical architectures, which can then be reused country by country, a sort of investment which one wouldn't necessarily make in one country standalone. We've made those. We've made sure that OpenCRVS meets very highest standards of data protection, cybersecurity, and interoperability with open standards such as Health Level 7 fire standards, for example, were pretty standard in the health sphere. And just maybe just the last moment in this introduction, some of the work which we've been doing in Bangladesh, I think, is now getting really quite exciting. We've been working together with Anir for a couple of years and colleagues in Bangladesh. We've been piloting recently OpenCRVS using health assistance. That model which Anir referred to, the health assistants, capturing data in local communities. Well, we've been exploring how we can actually then digitize that process, so equip them with the mobile means to be able to capture data in communities in an offline or online mode, capturing that data and pulling it into the system. Also integrating with other health systems. So just yesterday, we proved the technical interoperability in between DHIS2, capturing data within hospitals and sharing that with the civil registration system. So that's now working. That's really exciting. And also integration with national ID, checking the validity of parents' ID numbers as they register births, for example. And still work in progress, but maybe a stat just to share with you, right at the end where we're getting to. So as we're piloting, we're adopting a continuous improvement process as we're learning every day. So levels of birth registration within the first year of a child's after birth, where we're pretty low when we started. We're now up at sort of 50% of births within the pilot area getting registered within the first year of birth. And obviously we want to push that higher and higher as the pilot goes on. But exciting stuff coming from our work in Bangladesh at the moment. Thank you.
Thank you. Thank you, Ed. And Vilas, I will turn to you for your opening remarks.
Thank you, Rebecca, and thank you, ID 2020, for having me. I was reflecting as I was listening to this panel speak. I was thinking about a moment from my childhood, and I will tell you that somebody who's generous might have called me precocious. I think eccentric is probably the better word. But I had this thing I would do when I was a kid, which was particularly for older members of my family. I'd love to ask them to see what they kept in their wallet. And to this day, I don't really know where it came from, but it was an incredible pathway into storytelling. I remember my grandfather always had this 5-inch thick wallet that he would carry with him anywhere he went. And so one day when I'd been through all the other relatives, I went to him and I said, "Show me, grandfather, show me what's in your wallet." And he started taking me through it. And the wallet was composed entirely of every form of ID or certificate he'd ever been issued in his entire life. And he loved showing me the current stuff and talking to me about how he went to the pharmacy and this and that. But as we got deeper and deeper into the wallet, we got to the stuff from when he was in the independence movement and when he was doing things against the British in India in the 1940s. And he told me the entire story of a life richly lived. I think when we think about digital identity and we talk about it, particularly for children, it's so easy to jump immediately to service delivery. How does a government interact with a person and how do we give them an identity in that context? I think for me, it's really important that we start instead from a different place. What does it mean to have digital identity as a way of thinking about dignity in a digital age? And as we begin to think about who's going to create those identities for us, what their motivations, their agendas, their structures are, I think there's no way to really move into that conversation without first asking what's in the interest of the individual. I'm struck also by the image of those that folks like my grandfather carried that at the time were very little text and were really just an imprint of their baby footprint. And what does it mean for a baby footprint to now become a digital footprint? I tell you that very personal story to frame how I think about this set of problems from the context of being a philanthropic or a civil society institution, right? Our drive, our motivation is not simply to think about how we present a technical framework or an architecture for somebody to access services. It's not to think about how we create efficiencies for governments. And it's not even as admirable as it is to think about how we interconnect the different parts of the social sector that are creating these opportunities for individuals. But it is to think about where do we start from? So if we as civil society want to find the amazing economic, social, and medical opportunities that our co-panelists have presented today, what are the interests of the individual first in seeking that? So obviously we can start from a place of, well, of course, these are essential services and they must have them. But I'll just ask the question, when have we ever asked anybody, what is the form of digital ID you want to have? We can have an intellectual conversation about the need for self-sovereignty, of interoperability, of designing for ethical values around how that data is used. And so for me, I would just start from a place first of consent and co-design. Right? So as you think about your presence in the world, what is it that you hope that others will be able to take from you and use for your benefit? This is a starting point. But also, what is it that you hope to seek from that relationship? I think philanthropy and the civil society have a unique position in this, right? Because I think where each of the entities that we've described and the kinds of vertical segments in which they operate drive really significant short-term outcomes, I think civil society has to step in to be the one that knit it together. To say having multiple digital identities is not a problem. The question is, where is the interoperability between them? How do they talk to each other? And most importantly, how does the individual find agency in that conversation? I am really excited then to come back to some of my co-panelists' comments. The idea that vaccination records are just the start to something much more robust that talks about really a global health record. To think about how the use of technologies like CRVS or distributed in Bangladesh can present incredible catalyst models for how we might scale them. And I will just suggest, and only because I think panels are more interesting when there's creative tension, that as much as we should learn from these examples, they don't necessarily have to be the single pathway we use to a global expression of digital identity. And the question really is going to be, how do we bring together the broader landscape of actors to figure out what worked well, what maybe could be improved upon, and again, how we put the individual back in the conversation. I'll stop there and really excited for our conversation to come.
Thank you. And thank you to all the panelists for your opening remarks. There are so many themes that you have touched on that we could fill 2 or 3 more webinars on this conversation. But something I just want to call out is that as we talk about digital ID for the next generation, and I love your comments about, thinking about it from what's in it from the end user perspective, and how it's usable and suitable for use in the contexts that we're talking about here today. And I just want to comment that we've already kind of heard two different approaches that, on the surface seem divergent, sort of traditional civil registration, kind of conversations around more centralized approaches to data management and legal identity versus decentralized or digital IDs or health IDs as a touch point. And yet both are being implemented in Bangladesh as part of a shift from legacy systems, including many paper-based, to what you call digital Bangladesh. And I'm wondering if we as a panel could take a moment to kind of comment on the ecosystem that is facilitating that transition. Certainly, Anir, how those approaches are merging in Bangladesh and your vision for that, but also Ed, how you envision your solution and your system evolving to integrate with emerging digital technologies. And certainly, Vilas, as that conversation trends toward ecosystem development, where do you see civil society plugging into those specific questions and conversations? So Anir, maybe I will turn back to you to kick us off for this conversation, this section of the conversation.
Thank you, Rebecca. I'll draw on a couple of technology issues, actually. So once we started the process of merging birth registration and national ID, we realized that interoperability was a big issue. The different IDs that were proliferating in Bangladesh, at least half a dozen, and many people had multiple IDs, and they were different. They lived in different silos, and one ID did not talk to the other one, and one ID did not identify the person as the same person in a different ID database. So the person was identified as two different people, two different databases, because the person had two different IDs, and so on and so forth. So what that prompted us to do was to look at our national ID database, which was biometrically verified, as I mentioned, as the single source of truth. And this is what we're now exploring. The birth registration system is asking the national ID system to generate a digital ID that will be given at birth or during immunization. So immunization is the starting point. And the immunization record, as Vilas mentioned, becomes the health record, becomes the national ID record, really. So that's the starting point. It has a lot of technical issues that we're now working through, a lot of legal framework that we have to change, because over the years, we've actually developed new forms of legal frameworks without really understanding how it affected existing frameworks. Can you still hear me? I'm actually getting some internet alerts saying that. Rebecca, can you hear me?
We can hear you loud and clear.
Okay, great. Thank you. I just wanted to check, because I thought I was getting disconnected. Yeah. So so that's one point of integration that we are doing between the birth registration and the national ID. So national ID is generating the ID for birth registration. So that's the integration that we did. OpenCRVS comes in at exactly that point. So OpenCRVS, because it is a standards-based, global best practices included, and vendor neutral platform, vendor agnostic platform, because it is open source and we get best of ideas there, and we're not locked into any vendor. We'll use that mechanism. Now, all the other digital IDs, when a child goes to primary education at age 5 or 6, gets a new digital ID, goes to secondary education at maybe age 11 or 12, gets another different ID. So what we're saying is that the same ID has to proliferate. The same, no new ID can actually be given to that child. So it will use the same ID throughout all different systems. So Vilas's point about the issue of dignity and one single identity throughout one person's lifetime, from birth to death, from basically cradle to grave, is what we are trying to ensure. It is technologically challenging. It is legally challenging. And also operationally, administratively, it's a very difficult task to get 18 different permanent secretaries chaired by the cabinet secretary and say, okay, get rid of all your IDs and you'll get one ID starting at birth or at immunization. And that's the ID that's going to be. But before that happens, we all have multiple IDs. So there is this transition period, potentially 7 years to 10 years, that we have to live with multiple IDs. So the child who's born today or born a month ago during immunization will get the ID that will see him or her through his or her entire life. But the rest of us who have already been born, the 165 million of us, will have to have multiple different IDs, which will be phased out at some point. So we'll have to have that transition phasing out plan as well.
Anir, Ed, were you about to jump in? Oh, sorry, Ed or Vilas, were you about to jump in?
Yeah, I can certainly go next because you know, Anir has sort of mentioned the sort of the positioning as he sees it, sort of using OpenCRVS as a technology enabler in Bangladesh. You know, one thing that I feel very proud about in terms of OpenCRVS, in terms of, you know, the development of a technology platform, which is a digital public good, is that it's not really our system. You know, at the point where we make it a digital public good, you know, it's out there, you know, it's fully documented. You know, as people see fit to develop it in different directions, make it more decentralized or add components onto it, that, you know, it lives, you know, at that point it's kind of its own life, and we'd love to sort of collaborate with the community to continue sort of developing, you know, the core product, of course. But I think that's really exciting, and that's our, you know, in a way, what Plan has done by leading this work with partners is to create this core product, you know, and that's our contribution to this space. And hopefully, you know, we can see it. You know, we can't predict which direction it will go in, but we think at least the sort of core civil registration component needed to be strengthened. And I think we've done that. So that's exciting. And I think, you know, the prospect of the Digital Public Goods Alliance and the work which is being done there is like super exciting. And we're only just seeing the start of it. From a product perspective, already the discussions I've had with folks working in more decentralized, user-centric IDs, we've had lots of discussions. You know, within our product backlog, we have a component which we've yet dared not to develop, which is really at the end of the traditional birth registration process, where currently we're then printing out a paper birth certificate, because of course OpenCRVS needs to conform to existing laws as a starting point. But of course, over time, we don't foresee that being the end solution. You know, hopefully there's something else which can be provided to the individual, which is potentially more useful than a paper birth certificate. But probably the mechanism to gather that data can still be the centralized model of OpenCRVS, but then the possibilities are endless. Let's not forget the CR and VS components. So civil registration, you know, recording of occurrence and characteristics of vital life events like birth, death, marriage, divorce, and then the creation of vital statistics on the back of those. So that's the statistical information which is captured at the same time as those, as the legal part of civil registration, which is used in the best instances, you know, by the National Statistics Office, and is the sole source of continuous population data. So that's a holy grail as well, to provide the information for that. So we need to be careful that it's not, you know, identity is not over personalized, so we miss the opportunity of having that population data, which is so vital. Yeah, that's all for me right now.
Unless you're on mute.
I might jump in if that's okay. I love these points, and I'm just going to take, so Anir, I love that you spoke at it from a technical framework perspective, but you also referred to the need for new legal systems and new frameworks by which to use identity. And one of the questions I've been thinking about a lot is the reality of a world we're moving into, where transborder migration really becomes such a material phenomenon. And even in the context of using open standards in developing the identity systems, the ownership of data, the way that these are allowed to become portable. And I think there's a really interesting set of legal, ethical, and normative questions around that. And I just wanted to put that out there to see how people are thinking about it.
Absolutely. And if I could put a more specific ask on that question, where I'm not just thinking about the legal and norms and standards around it, but also how it directly relates to children, who of course are the focus of our conversation today. And there's any number of conversations we could have about architecting this solution across the lifespan, but how do we think about that, particularly when children and minors are involved? So putting that one to the panelists as well.
I think that's a really interesting question, particularly when, to so many of the points that Vilas has made, that I would love to have the time to engage a discussion on this for so much longer. But this idea of what do people want from a digital ID, not just how does it serve government, how does it give us good statistics, how does it promote good service delivery, but what do individuals want? And I mean, when we are talking about looking at a program which is based on registration at birth, registration at the first dose of immunisation, that's not really a time at which an individual can engage their government in a discussion on what they want around their digital ID. So it really points to framing this conversation in different countries and getting different learnings around what do communities want. Immunisation or birth might be the entry point, but how do communities see this sort of digital identity being developed? What are the concerns that they might have around the use of that data? Where is it held? Who has access to it? How can it be transferred across ministries as well? And that raises all of those legal questions that you mentioned before. And certainly from our perspective, in terms of supporting this program in Bangladesh, this is precisely what we want to do, is raise some of these questions up. Look at what are the technical considerations, the programmatic considerations, the community considerations, and the legal and regulatory considerations, and learn from that so that we are actually able, if this system is working in Bangladesh, if we can demonstrate improvements to immunisation, we're able to build upon that Bangladesh experience where there is such a receptive government to this. The government has such a strong agenda around this already. It's the perfect environment to test out some of these ideas. But our interest is to then take that learning to the 73 other countries around the world that Gavi is supporting. So, but I think these are fantastic questions that have been raised for our consideration too.
Absolutely. And sorry, Anir, did you want to jump in and respond to that?
Sure, if I can get maybe
Absolutely.
2 minutes. Sure, I think Vilas's question is very important. So what do people want? What do the holder of the ID, what do they want? And I mean, we can go on to a very, very long discussion and debate about this, but I see people want three things. It actually starts with dignity. So person with an ID, without an ID. And I deal with, one of the projects that I run in Bangladesh is to develop an ID system, credentialing system, and ID 2020 is actually guiding us on this, for the Rohingya refugees, 1.1 million Rohingya refugees. And you can actually see in very stark reality the difference between having an ID, before having an ID and after having an ID. So the person gets an identity. He or she can do things with that identity. Second thing is that access to services. So even though it's a government construct, it is important for a person to get education services, health services. In the case of citizens who have access to maybe land services, which is matter of life and death in the context of Bangladesh, which is a very small land mass and 160 million, has 65 million people. So access to service is very, very important for people. With that identity, they can get access to the right service at the right time at the right place. The third is really confidentiality and privacy. So they want their data to be secure and they want their data to be controlled by them. This is, however, a much more of a mature thinking. The dignity and service access, service provision, I think come first. And then the idea about, okay, whether my data is private to me. I think those are the three different things. And the cross-border thing that you talked about, Vilas, you also pointed out, Rebecca, you pointed to that, is something that's becoming very important right now as we are dealing with health information that is required for travel during the COVID time, which was not needed before. So I'm working with an organization in New York called Commons Project, and there is a common pass, a common health passport. The health data, specifically COVID testing data, tied to travel information. So that data will be coming through the common passport. So again, we're looking at confidentiality and privacy of information across multiple boundaries. In this case, travel, health, and potentially other things in future. So that portability of an ID, I think, is becoming more and more important. So standard-based, interoperable, portable ID that is secure, private, and that gives you dignity and services.
And Anir, that's a great point that I want to turn to a question for all of our panelists. Was as we talk about the provision of digital ID, and particularly for children and adolescents, how has the COVID-19 pandemic accelerated your work or made this work more urgent? And I ask because certainly, Anir, the work that you just pointed out on travel and opening up international borders is important. But I'm curious the conversations you're having within your organizations around the need to digitize legacy systems. And we know that many immunization systems continue to be paper-based. Many of those international regulations continue to be paper-based. So I'm curious how conversations around, or the pandemic has accelerated your work in this space, and how it's made you think about extending this not just across immunization and health systems, but certainly down to children and adolescents. So I open the floor to anyone who wants to take that question first. And while panelists are answering, let me remind our audience that you still have some time to submit your questions, which we will turn to after this.
Look, I might start. It's an interesting question. I mean, if we look at a possible COVID-19 vaccine, which the world is, waiting for with bated breath, we realize that when these vaccines come out, they are going to be in limited supply, and we will need to ensure the most effective use of those vaccines that are made available. So that's targeting the critical populations initially around the world: health workers, social workers, other frontline workers, and then moving to at-risk populations. What countries now are trying to do is identify the numbers around those target populations, and that can be challenging in the absence of having good quality data through the health system, or in the absence of having a coherent data system. Often Ministry of Health has multiple parallel systems, and these systems don't speak to each other. For the effective rollout of COVID, we need to be able to identify those populations. We need to be able to put numbers to those populations. We need to be able to track who is vaccinated and who is not. And all of that would be vastly facilitated by effective electronic systems, be that a unique digital ID or just electronic systems that work. So I think it's really something that, as governments around the world begin to look at this, it's really making them revisit their data systems, revisit their approaches to electronic registrations and to unique identifiers. So I think it's a tremendous opportunity to be looking at how we can improve those systems, and digital identity might be one of those.
I want to jump in and wholeheartedly echo everything Sam said. I think it's spot on. I would suggest there's an additional element to this, which is if you think about vulnerability and access to a potential COVID vaccine, you think particularly about children in that context. There is a level of analysis here that says those systems where digital ID is present not just lifts up and makes sure that those children are seen who might not otherwise be, but also that there very likely is a correlation between the availability of vaccine and the present sophistication of the systems that find them. And so I wonder if there's additionally on top of all of this just a mapping exercise that happens that lets us say here are additional areas that we need to particularly focus on, because the underlying correlation actually defines whether or not we're getting vaccine to the right places.
Maybe I'll talk about a couple of examples of how COVID has accelerated my work. We call digital dividend, and we started talking about COVID dividend this year in the last 7-8 months. Maybe a couple of examples, some tied to digital ID, some not. So I'll start with one with digital ID, where we had to provide social safety nets to about 5 million new poor households. So these were households that became poor. They were never registered as social safety net beneficiaries because they were not poor enough. Now they went below the poverty threshold because they lost jobs, hawker jobs, rickshaw pulling jobs, taxi driving jobs, many jobs that just disappeared overnight when the lockdown happened. So we needed to provide that, and we needed to create digital accounts, financial accounts, because we're not going to send cash. to actually send digital money. So we needed to create bank accounts or mobile wallets within weeks. So 5 million mobile wallets were created with the one new regulation by the central bank that you could do a simplified, what is called the EKYC, electronic know your customer. So essentially it's tied to the digital ID, the national ID that we had. And overnight we created millions of bank accounts, and we were able to send money to these 5 million poor households. Another example is our judiciary, not an ID issue, but how COVID has accelerated digitization. We have been working with the Supreme Court for the last 5-6 years, not a lot of movement. But when the prisons started getting overcrowded, we needed to do bail hearings, and the courts were not open. So we were able to do virtual court hearings, similar to what we're doing here now. And that basically accelerated adoption of digital means. So there are many such examples where we used ID or used digitization to move things along. Along with the commitment, political will of the current government to establish digital Bangladesh by next year, COVID obviously was not a welcome thing, but it accelerated adoption of digital systems. It actually created new laws, as I talked about, within like maybe days and weeks, which would have taken us months, if not years, to pass these new regulation and laws. So it facilitated some new things as well.
I do want to make sure we have time for at least one audience question. And I like this one because I think we can generalize it to bring us to some closing remarks from our panelists today. The question is, what have been the greatest challenges in terms of building consensus across various government agencies in this work? And what I may ask is let's talk about building consensus, not just across government agencies, but across the various stakeholders we heard from here on the call today and who isn't on the call today, whether that be private sector, technology providers, intergovernment agencies, multilateral agencies. But I'd love to hear your reflections on where we need to build consensus, the challenges on this, and maybe even your calls to action to the community who's listening in here today.
Maybe I'll go first.
I was going to suggest see if Sam wanted to jump in first, but Anir, by all means.
But if Sam wants to go ahead, that's fine.
No.
No, Anir, I'm still thinking. I'll
Okay.
defer to you.
Because I deal with it day in and day out. So
True.
maybe I'll... I think the single biggest challenge is, will I lose my control? So that's the question. So the data that I have, whatever it is, it may be little data, it may be large volumes of data. So if I start to interoperate with somebody else, if I start to share, if it becomes a public good in some sense and not something that I control, so do I lose my authority? I think that's the first question that is asked. And that's a very difficult question, by the way. It may sound a bit, and I'm not trying to make light of the situation. It's actually a very important question, because governments are defined by rules and very set rules. And that's how you maintain status quo. Government is not created to create disruptions or innovations or break things down. You actually maintain status quo, maintain order, and that's how governments are trained to think. And that's the way it should be. But then that poses barrier to innovation. I mean, what we're trying to do here will actually require us to rewrite laws, will actually require us to rewrite the way we think, rewire the way we think. And so we have to go beyond that. We have to somehow answer that question in a way that is not threatening. And the way we have tried to do that is to use maybe sticks and carrots, both. So setting a mission, setting an agenda, in the case of CRVS, creating that high-level committee chaired by the head of civil service, the cabinet secretary, who can actually convene all the other permanent secretaries and say, we will have one ID. And let's figure out how to do it. And getting buy-in from the prime minister saying that, okay, we will have one ID. And that's the political agenda to go forward. So that's sort of the convening, sort of the stick in a sense. But carrot is in a way that when we're able to meet some of those goals, that we are, so once people start seeing the benefit of that and that they don't actually lose control, sharing does not mean you are actually losing control. Once they understand that, and that's when we had to do a lot of training, a lot of sensitization, a lot of what we call the enterprise architecture around CRVS. So what will it look like? How much control do I have? When I share data, I'm giving somebody else control, but I'm not losing my control. So I think making people understand that has been the way that we have been able to do things. And similarly with private sector as well in the COVID timeframe. If I have time, I'll address that.
Can I go next, Rebecca? Do you mind?
Absolutely.
Because I'd like to point out that, you know, our project has certainly been the beneficiary of the convening power of the cabinet division, for example, in Bangladesh, who has this role of bringing together ministries. So it's incredibly powerful. But I can't comment further about, you know, consensus within government, but consensus in terms of technology and platforms and enablers, I think maybe is quite interesting. And back to my point about digital public goods, of which I'm clearly an advocate. There's something interesting which happens, you know, as we started creating open CRVS and we reached out to governments and other development partners, etc. And there's, you know, we found there's an incredible willingness to contribute to something which is seen as a public good, and to do it the right way. We had, you know, incredibly commitment to our technical advisory group from multiple sort of UN agencies and others, etc. Ensuring what we did was, you know, done in a rights-based approach, for example. So I think there's something in that in terms of common goods which can be reused, you know, in different countries. And as you asked for a call to action, otherwise I'll not get the chance. You know, call to action. You know, on this call, you know, there's been a bit of a focus, as you framed earlier on, in some of the more formal sort of civil registration systems, and then the more portable, user-centric digital ID. There's others, you know, foundational, you know, ID systems as well, both in their proprietary and digital public good forms, etc. Rarely, you know, have we got together to actually draw out, you know, on a whiteboard. You know, I'd love to get in that session and start drawing out the full ecosystem of what all these pieces could be together. You know, it's often we're doing it somewhere in silo and putting the case for our piece of the puzzle, but it's probably not good enough, is it? And I think that's what I take away from this call, that it's not enough, and the value can be very much greater by, you know, having our respective approaches, you know, work, you know, together rather than against each other. So that's my call to action.
Maybe if I could jump in next then, and just to say I completely concur with everything that Anir and Ed said already. And to Ed's point around some of this technology being a public good, I think he's hit on a really important aspect of the work that we're looking to support with the government of Bangladesh, which is trying to keep this technology agnostic. So testing out systems, putting in place an overarching framework, but one that the government can own, manage, and can control, irrespective of the service provider. And on that one, I suppose, technology barrier, if we are talking about immunisation as an entry point for the establishment of a unique ID, is biometrics. We haven't touched on it, but how do you capture infant biometrics? And this is something we're really keen to test out in the context of Bangladesh. The final point I'd make, and it's not so much, it is a call to action and it's not a barrier, but it's a challenge. It's making sure that as we do this in Bangladesh, we are really capturing the lessons here. We've got a government with tremendous political will and a government that is so digitally agile that they can pivot a response around COVID like that seemingly and get it in place. So it's a fantastic environment to test all of this out, but we need to be capturing the lessons through this program, the technical lessons, the programmatic lessons, the legal and regulatory lessons, and to Vilas's point as well, the sort of community acceptance lessons, so that if we do want to learn from this and scale it to other countries, we've got some real evidence there. So that's one challenge that I would call all to be capturing these lessons and ensuring we have evidence that this works.
Vilas, to you to bring us home.
You know what, Rebecca? I have found you to be such a thoughtful expert on these issues. I'm going to respectfully defer my time to you, and I'd love to hear what you think about it. And with gratitude to ID 2020 and all of you. Thank you.
That's very kind. Well, thank you all. We are indeed right at time. You know, I'm reminded of what I loved Ed's visual of that. One of the things that we need to do when we think about consensus building, whether that's within government, whether that's across agencies, technologists, private sector, emerging technologies that Sam alluded to that we haven't even spoken of today. All of these different perspectives are essential to ensure that whatever is built is fit for use and fit for purpose in the context in which it meant to be used. Vilas, to your points, and Anir as well, it's about dignity, and it's about ensuring that tools are usable and suitable so that everyone can have dignity. And so I'm reminded, and I hope that this is just the beginning of a really important set of conversations and perhaps some whiteboarding, certainly that this group, but to our broader audience that we invite to participate so that we can truly understand the impact of this work and the potential for it to really transform how we ensure children, adolescents, and really all of us thrive. So with that, I thank our panelists for our time today. I'd also like to thank our audience for taking time out of their day. Remind folks that this session will be available tomorrow. It has been recorded, so please feel free to share with your friends and colleagues, particularly as we put out that call for greater dialogue on this. And as Ethan noted at the outset, these webinars are part of ID 2020's ongoing commitment to foster collaboration toward a future with good ID for all. So thank you again to our panelists for being part of that conversation and community, for their time here today. And we look forward to seeing, I'll say all of you, during our closing keynote with Congressman Bill Foster of Illinois next Thursday. And with that, good morning, good afternoon, and good evening, everyone.